Hi, my name is Lola Lorber, and I'm a birth and postpartum doula. I'm also a certified lactation counselor. Today we're going to talk about 7 different signs that might mean you're going into labor. Sign number 1. If your cervix has dilated and effaced a little bit, you might lose your mucus plug. You'll know that you've lost your mucus plug if it comes out in the toilet, or if it's in your underwear, or if when you're wiping, there's a big clump of kind of snot-like, a little bit more than discharge. Sometimes it's a little bloody, sometimes it's green, sometimes it's yellow. That is your mucus plug. Often it can come out all at once. Sometimes it comes out in little pieces. So that is a sign that you might be going into labor soon. Sign number 2, if your water breaks. Sometimes your water will break and it'll be like a big gush of fluids. Other times it's more of a consistent leaking. It's hard to tell if it's the leaking feeling if you're peeing or if it's your water breaking, but the fluid that comes out when your water breaks is amniotic sac fluid, and it doesn't smell like urine. So the fluid is usually a clear liquid or a pale yellow. If there's like an excess amount of blood or any dark colors in your water, definitely call your provider and let them know immediately. Sign number 3 that you might be going into labor is heightened emotions and nesting. If you have an unrealistic urge to finally scrub the bottom of your bathtub or reorganize the nursery in a completely different way, that might be a sign that you are going into labor. So you may be having these heightened emotions and nesting feelings because the hormones in your body are drastically changing and getting you ready for labor. Labor sign number 4 is if you're having lower back pain and intense pressure in your lower back and your lower abdomen. Baby is moving down the birth canal, and so there's less space down there. So you might be feeling like it's just a little bit tighter and a little crampier. Labor sign number 5 is frequent urination. If you find that you're going up and down to the bathroom a lot more than before, it's again a sign that baby has been moving down through the birth canal and is pressing up against your bladder, which is making it smaller and have less space to hold your urine, so you're going to the bathroom more often. Labor sign number 6 is if you're having softer and looser bowels a little bit more frequently. That again is because baby is moving down, there's less space down there, and your body is trying to clear out and make more space for baby to come out. Labor sign number 7 is that your cervix is going to be dilating and effacing. So when it's dilating, it's opening, and when it's effacing, it's thinning out. You're not actually going to be able to see that, but you will be able to feel it with contractions, which are like intense cramp-like feelings. You're going to want to head to the hospital when your contractions are getting closer together, lasting for a minute or so, and have been consistent for about an hour. Some people use the rule of 5-1-1 or 4-1-1, and that means that they're 5 minutes apart, lasting for 1 minute, and have been consistent for 1 hour. So anywhere within that range, that's a good idea to really start thinking about going to the hospital. So those are my 7 signs that you're going into labor. Remember to keep in communication with your healthcare provider, and if you're working with a doula, definitely let them both know these signs as they start occurring.